Welcome to Med Madness Podcast, where we dive deep into the complexities of medical conditions and their management. Today we're exploring Fetal Growth Restriction, or FGR, a condition that poses significant risks to both the fetus and the newborn. Let's unravel what FGR is, how it presents, and how it can be managed. Fetal growth restriction is defined as an estimated fetal weight less than the 10th percentile or a birth weight below the 3rd percentile for gestational age. This condition is crucial to recognize because fetuses with growth restriction face an increased risk of intrauterine demise, as well as neonatal morbidity and mortality, including preterm delivery. Next, let's discuss the types of FGR. FGR can be categorized into two types, symmetric and asymmetric. Symmetric FGR represents a uniform and equal global growth impairment affecting all parts of the fetus, including the head, femur, and abdomen. This type of growth restriction typically begins in the first trimester and is often due to early developmental insults such as chromosomal abnormalities or congenital infections. On the other hand, asymmetric FGR is characterized by disproportionate growth impairment, primarily due to uteroplacental insufficiency and chronic fetal hypoxia. Maternal conditions such as hypertension and pregestational diabetes mellitus predispose to abnormal placental development, leading to progressive placental dysfunction during the late second and third trimesters. The fetus adapts to impaired blood flow and reduced oxygen delivery by redistributing blood to vital organs like the brain, resulting in a head-sparing growth pattern while the growth of other organs such as the abdomen is compromised. Clinically, these distinctions are important. Symmetric FGR shows a global lag in growth, affecting the entire body uniformly. In contrast, asymmetric FGR presents with a head-sparing growth pattern, where the head circumference remains relatively normal compared to a much smaller abdominal circumference. This adaptation helps prioritize brain development in the face of limited resources. Managing FGR involves careful monitoring and timely interventions. Regular non-stress testing, weekly biophysical profiles, and serial umbilical artery Doppler sonography are essential components of the management strategy. Additionally, serial growth ultrasounds help track the growth pattern and assess the overall well-being of the fetus. Early detection and consistent monitoring can significantly improve outcomes for these high-risk pregnancies. Now, let's consider a real-life case to illustrate these concepts. A pregnant woman in her 3rd trimester was referred for an ultrasound due to concerns about her baby's growth. The ultrasound revealed that the fetal head was measuring 2 weeks smaller, but the abdomen was 7 weeks smaller than expected for gestational age. This significant discrepancy indicated asymmetric FGR. The most likely cause in this case was maternal hypertension. Even when well controlled, hypertension can lead to underdevelopment of the spiral arteries in the placenta, increasing vascular resistance and reducing blood flow to the fetus. The healthcare team initiated close monitoring with regular non-stress testing, weekly biophysical profiles, and serial Doppler studies. They also scheduled frequent growth ultrasounds to keep a close eye on the baby's development. Thanks to these proactive measures, the team was able to deliver the baby safely at 37 weeks. Although small for gestational age, the baby was healthy and quickly caught up in growth after birth. This case underscores the importance of recognizing and managing FGR to mitigate risks and improve outcomes. Fetal growth restriction is a complex condition, but with vigilant monitoring and appropriate interventions, we can ensure the best possible results for both mother and baby. Thank you for joining us on Med Madness Podcast. We hope you found today's discussion on fetal growth restriction informative and insightful. Stay tuned for our next episode, where we continue to explore critical topics in medicine. If you have any comments or questions, feel free to reach out. Until next time, stay curious and stay informed. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io?UTM_source =11labs_GPT.